Good afternoon. I am Ellen Jones, the Public Information Officer for the Anne Arundel County Department of Health. Welcome to the Health Department's COVID-19 Facebook Live broadcast. Today, Health Officer Dr. Nilesh Kalyanaramman is joined by the Department of Aging and Disabilities Director, Pam Jorden, and Mental Health Agency Clinical Director, Catherine Gray. They are answering questions provided in our Facebook AA Health comments or by email covid19info@aacounty.org. So first, let's have a COVID-19 public health update. Doctor?
Thank you, Ellen. Thank you for joining us today, and I want to thank Pam and Catherine for joining us today as well. We have been now, it's almost 3 weeks since we've had our first case of COVID-19 in Maryland. We have many cases here in Anne Arundel County, and those are going to keep growing. As of this morning, there were 423 reported cases in Maryland. What we can expect to see is that those numbers will rise. What we're looking for is that they stop rising as fast as they are currently. And that's where the social distancing comes into play and all the actions that we've taken. So the school closures, and it was just announced today that schools throughout Maryland will be closed until at least April 24th. Government, business closures, the ban on gatherings of more than 10 people, excuse me. All of that is meant to decrease the amount of movement and interaction between people, because that is the most effective tool we have. It's also the only tool that we have. There are no medications, there are no vaccines at this time. And so the only thing to stop or slow the spread down is to prevent the spread to begin with. And so that's also where your actions come into play. Every single day, all the things that we're used to doing, we're now asking you to think about every single one of those. How close do you get to somebody? How many people do you see in your daily and weekly life? How many times do you go out? Those are things you never thought about before because you didn't really need to do that. And yet, in order to decrease our risk, and not just our personal risk, but our community's risk of spreading the virus, each of those things has to be decreased and minimized. So that means not going out as many times. If you're going to go to the grocery store, going out once, not a week, not going 3 times a week as you need to. That means not interacting with the same large number of people you might have before, but interacting with a much smaller group of people. And making sure that you keep that distance of at least 6 feet, observing hand washing or hand sanitizer, excuse me, and disinfecting frequently touched surfaces. It may not seem like much, but it's actually a lot. Because in public health, every one of those little actions builds up, and the more each of us does that, the more successful we will be as a community in slowing the spread of this virus. I know there are a lot of questions about testing, so I'm going to get to that right now. Testing is an important way to do 2 things. One, understand the spread of virus in our community, but also to, obviously, for each individual to know if they have that or not. There are limited supplies of both the test kits and the materials necessary to run those tests in the lab. That's why there isn't as much testing as we need. And that is a federal issue that is slowly working its way through, but is not something that we can change. We can change through our willpower, though we might want to. And so for that reason, we're really focusing on how do we make sure that we test those at highest risk and those at the second highest risk. And that highest risk group are people who are hospitalized or require hospitalization, and healthcare workers who are constantly working with these hospitalized patients. The next category of people we're looking to test are people who have symptoms and who have other vulnerabilities. So people who are older, generally 65 and older, we're targeting for testing. People with chronic illness, people who live in congregate homes, so those are group-type settings, assisted living facilities, homeless shelters, transitional housing, group homes, that sort of environment. And then first responders. And after that, once we can get all of those folks tested, after that, then we can test others who have symptoms. we never recommend at this point testing people without symptoms. And so we're actively working to get additional test kits, but also to make sure that if we get those test kits, that we're going to get the results in a timely fashion. For those of you who are hearing from friends, neighbors, or yourself may have been tested, it's taking about 4 to 7 days to get test results back. And if you can imagine in a hospital setting what that would do, that makes it really hard to provide the right care. And so we don't want to test more people if we can't make sure we get the results back in time. So that's also a limiting factor, and we're monitoring that closely. As part of that, we're looking at very much at how we're caring for those vulnerable groups. So making sure that we as a county we've gone out to those congregate home settings to make sure that there's social distancing happening, that there's infection control, providing support, and also providing testing capacity if needed. If somebody there has symptoms, because we want to make sure we deal with that really quickly so there isn't rapid spread. That includes working with our homeless population, those who are unsheltered and those who are marginally housed at this point, and looking at how we work with elderly, and that's why we have Pam Jorden here today as well. So I just want to emphasize one last point before I turn it over. The key to everything that we're doing is really focused around our education platform. How are we providing the information you need to make those changes in your daily routines to be able to slow the spread of this virus? That's really our most effective tool that we have.
Thank you. Pam?
Thank you, Ellen, and thank you, Doctor. Good afternoon. My name is Pam Jorden, and I'm the director of the Anne Arundel County Department of Aging and Disabilities, as Ellen previously said. So before I get into some of the broader things we are doing, I just want to remind people that our department is always here, and we serve older adults, people with disabilities, caregivers, and anyone planning for their future. And I think that just touches about everybody in our population. So it's certainly the COVID-19 public health emergency has brought our staff to a new level in terms of public response. We have 24 different programs that serve the population, especially older adults. And every morning since this started, we do a roll call with our 24 programs, and we do a briefing every morning. And we've done some really creative things trying to achieve our mission now. So the critical mission is definitely keeping our older adults, people with disabilities, and caregivers safe, informed, and the big one is connected. But how do you do that when you can't come to a senior center anymore? And that's very impactful. We have 7 senior activity centers, and people get used to going to those centers and socializing. We serve a hot meal, a hot lunch at the senior centers. There's lots of activities. There's very robust Anne Arundel County Community College programming that goes on, and exercise. So what we've been doing is we found we had about 10,000 clients that we touch every day through our 24 different programs. And we're all calling those clients. And we even have firefighters who have stepped in to help us, people from the Office of Information Technology. It's really been something to see the employees of Anne Arundel County who have stepped up to help us. And I'll tell you a little bit more later about some of the police cadets and the sworn officers that have helped us out with some other things. But we're making a phone call to our 10,000 clients that we know about, and you'll get some phone numbers later from us. But I encourage you, if you know of somebody that's isolated, make sure we know the number, because we're going to call. And they've been really rewarding phone calls, and we're finding that most people are feeling calm, that our older adults are feeling calm out there, and they appreciate the phone call. We get to hear and chat with them about their kids in California. We know some of their pets' names now. It's been really a really good experience. So we are going to continue to make those calls, provide safety information, and chat with our folks that are out there. Thank you.
And now, Catherine, tell us about some of the trends you're seeing with mental health in the county.
So how we're managing our daily lives and communicating with our friends, our family, other people in the community has changed significantly over the last few weeks. We're working from home, we're practicing good social distancing, we're practicing good hygiene, We're homeschooling our kids. We're refraining from large gatherings. These things have an impact on us. How folks handle change is really varies from individual to individual. We're going to answer a lot of your individual questions today that people have submitted. I do want to let you know, though, so crisis response is still operational. A lot of our behavioral health providers have moved to telehealth. The Behavioral Health Administration has encouraged all of our folks receiving behavioral health services to check in with their providers. But some of the trends that we are seeing is actually around the acuity of our folks experiencing or who are living with mental health conditions. They're scared. They don't know what to do. So we're reaching out. We're providing some reassurance for them. We're also doing some visits to them. And we'll keep monitoring those trends every week.
Thank you. Now, the most popular questions that we have been about testing. So, doctor, how soon will the county have COVID-19 drive-through testing, and will it be free?
So we are working with partners to stand up drive-through testing. As I mentioned a little earlier, one of our goals is to make sure that we don't put so many more tests into the system that we delay results for hospitalized patients. So that's a key thing we're looking at, and we want to make sure that those with the highest risk get their test results fast because they need it. And so that's part of our planning. We're hoping to get that. We're hoping to get drive-through testing in the next few days, week, but that depends entirely on the testing companies being able to stand that up for us in terms of turnaround time. The other part, in terms of cost, these tests are to be free, and they are free. That's per the emergency order, and so between primary care doctors, urgent cares, ERs, and the health department, we can make sure that anybody who needs a test can get that at no cost.
Thank you. The next question is, do I need a primary care provider to be referred for testing? And if so, how can I find one?
So if you do have a primary care provider, it's usually better to contact them first so that they can manage your care as needed, because even if you're having symptoms, it may not be COVID-19. If you don't, and that's okay, then you can certainly call the health department, and we are able to at least help you walk through your symptoms, whether they might be COVID-19 related, and then refer you to resources for care otherwise if they're not.
And the next testing question, how soon can you get the test result?
So right now they're taking about 4 to 7 days, and we're hearing reports that for some people it's taking even longer than 7 days. It really depends. There are different lab testing companies, and it just depends on which lab testing company your provider is using and what their turnaround time is. But that is obviously a really long time to wait for results, and that's one of our big concerns.
And I have a symptom question now for you. What are the mild symptoms of COVID-19, and what are the severe symptoms, and how do the recommendations differ?
So if you have mild symptoms and you're able to manage at home, so things like a cough, you have some mild fevers that you're able to manage with medication, and you're able to manage where you are and eat and rest, and you can handle it. Those are mild symptoms, and we encourage you to stay where you are, stay isolated, and ride it out, much as the same way you might have done for a mild flu or a mild cold. If your symptoms are more severe, though, so you're having shortness of breath, or worsening shortness of breath if you already have another condition that causes that, or you have fevers that are lasting, and generally we're saying more than about 3 to 4 days if your fevers are lasting and you can't break them with medication, that's the time to call and see what you should do next, either your primary care doctor or the health department. Now, if you have life-threatening symptoms, your shortness of breath, and you just can't catch your breath, your fevers are very high and you can't break them, that's the time to consider going to the emergency room when you have those severe symptoms.
The symptoms of COVID-19, the cold, the flu, and allergies. What's similar and what's different about those?
Yeah. So there's a lot of similarities, obviously, right? We're talking about cough, fever, and shortness of breath. Um, in terms of colds and allergies, we see much more runny nose, itchy eyes, those types of symptoms with colds and allergies. And itchy eyes is typically much more associated with allergies. But that runny nose, that congestion, the nasal congestion, that's pretty typical of colds and allergies. In terms of differentiating between COVID-19 and the flu, we tend to see much more of the fatigue and weakness with the flu. We don't see as much shortness of breath with the flu. With COVID-19, we see more of the shortness of breath and less of that fatigue and weakness. So that's a somewhat helpful guide. It's never really clean because the flu and COVID-19 are fairly similar in their symptoms, but that's a helpful guide to at least give you a sense of what's going on.
And one last symptom question that we received. How many days could a sick person carry the coronavirus before showing symptoms?
So generally, the average is about 5 days, but it can be anywhere from 2 to 14 days. And that's actually why if anybody needs quarantine, meaning that they don't have symptoms, but they have been in close contact with somebody with COVID-19, that's why the quarantine duration is 14 days, because that's generally, if you haven't developed it in 14 days, it's not likely that you have it anymore.
Thank you. Pam, some stores have special hours for seniors. How are these times helpful?
Thanks, Ellen. Our business community has been fabulous. The stores have really stepped up, providing some special hours for older adults and people with disabilities, generally early in the morning. And I think what's helpful about that is the stores have been stocking overnight. Our older adults have more access to some of the products that get cleared out through the rest of the day without naming anything specific. But they have a better selection of merchandise during the morning hours and these special hours. It also gives them a chance to do some social distancing while they're shopping, and there's not a mix of the general population while they're in the store. But the business community has been fabulous on many levels, and I'll have some other examples as we go forward this afternoon.
Pam, also, the frozen meals program. We've heard a lot about that, and what is it all about, and how is it going?
So earlier in our discussion today, I talked about how our department has multiple services. And a lot of what we do is under the Older Americans Act. One of those services is our hot lunch program for our older adults. So at our, actually at 19 locations throughout the county, every weekday, we are providing a hot meal for older adults. So we're still doing that in our congregate sites, such as Glen Square, Morris Blum in Annapolis City, some of those apartment settings where there's older adults and people with disabilities. And we're handling that a different way by delivering frozen meals that people can easily heat up in their microwave or an oven. But our challenge was our senior activity centers where people are, where they came to socialize and have a hot meal. So we set up a program with our nutrition participants where every Tuesday, and yesterday was our first launch, it went flawlessly. I'm so proud of my staff. This has been a Herculean lift to try to feed 1,100 people in a different way in just, let's see, senior centers closed on March 12th, and they really did a good job pulling this together. So this is typically for our regular nutrition clients. Now that being said, anybody 60 years of age or older will not be turned away, but we do ask you to register in advance. I'm going to give you a phone number because we need to anticipate how much food, but you'll get a box with 7 frozen meals that'll last for an entire week and keep you fed. So in order to put in, to sign up for this program, you can call 410-222-0256. The more efficient way to do it is through a website, and it's senior_nutrition at aacounty.org. Actually, it's not a website, it's our email address, and you can do that any time of day or night. I'd like to give a shout out to Meals on Wheels. They have really been a wonderful partner for us. They have been boxing up these frozen meals and meeting the demand seamlessly. So many thanks to our contractor, Meals on Wheels, for helping keep the community fed. But please call us if you know anyone 60 years of age or older. If you need some other assistance with food, we have an information and assistance line, and I'll give that number out in just a little bit, where we can help you meet some of your other food insecurity or barriers. So thank you.
Thanks so much, Pam. Catherine, stay home is the message that we're hearing. So, what are some tips for staying at home and not getting cabin fever?
Well, that's a good question because a lot of people are staying home. So the first thing is really to follow a routine. If you can follow the routine you had when your kids were going to school or when you were actually going to work, do that. Go to bed at the same time, get up at the same time. Take breaks from media coverage. It's really important because you will start to get information overload. Get your information from legitimate sources like the health department website. Take care of your body. Get exercise regularly, eat balanced meals, get regular sleep. Find time every day to unwind. It's really important that you decompress at the end of every day or at some point during the day. Connect with family and friends. This is a hard one because we are social distancing. We do have things called telephones, Facebook, Skype, WhatsApp, where we can virtually connect with our family and friends. Great time to call grandparents. They might like a phone call from you. The other thing is laugh when things are funny. It's okay. Yes, this is stressful, but we can still have a sense of humor about it. As a mom who has kids or a kid, they do funny things. We can laugh at them. We have spouses and friends who do funny things. The other thing is take the time to look at the silver lining. It doesn't seem like there is one right now, but there really is. We have this opportunity to spend time with our families. We have this opportunity to take time to do our spring cleaning in springtime. Maybe even time to reconnect with yourself, learn a new skill. These are all things that we can do on a daily basis to get through this.
Now, what about the children? This question asks, how do I let my children know everything is okay when I don't even believe it?
So, one of the first things you need to do when you're talking to children about this is process your own feelings with an adult, whether it's a friend, a partner, your own parent. Kids will pick up on your demeanor. Ask your kids what they've heard. You're really assessing where they are. If they're hearing rumors that can be really scary, older kids are probably hearing more factual information. Don't dismiss their feelings. You really do need to listen to them, to reassure them. Talk to them in an age-appropriate way. For elementary age kids, you're not going to talk about the virus in depth. Use language that they understand. This is a virus like the flu. Sometimes when people get the flu, they don't feel well, they feel sick. But there are things that we can do to prevent this. We wash our hands. We don't get too close to each other. For teens and older kids, teens don't always respond in the same way. You have some kids who are going to be very vocal and share how they feel about it, and other kids are just going to say, you know what, everything's good, I'm okay. But talk to them with accurate facts. Answer the questions that they ask. Give them the information that they're asking for, but you don't have to provide too much information. Talk to them, especially teens, talk to them about the importance of social distancing and why we do that. This really is to stop the spread of the infection. The sooner we stop the spread, the sooner we can get back to our normal lives. Definitely emphasize good hygiene with kids of all ages.
Thank you. Look what just came up, another symptom question. This one, do you agree, doctor, with testing someone who is asymptomatic? Why or why not?
No, for a couple of reasons. We shouldn't be testing people without symptoms. Right now, there aren't enough tests for those people who do have symptoms, so there really isn't a good reason to do that. The other reason is that when you test somebody without symptoms, what is to say that you shouldn't be testing them again in a week if they don't have symptoms, right? There isn't really a good reason to test people without symptoms. That's why we do the social distancing. We talked about the fact that people can people can have the infection without having symptoms for multiple days, and so you can't really test everybody every day. And so the only real way to manage that is to do the social distancing that we talk about.
Thank you. This question just came up also in the comments. When will our hospitals receive the PPEs that they need to take care of their patients?
So that's a big issue. I didn't touch on that when I first started talking, but that's a ongoing conversation with our hospitals. They just got. So let me back up and say that there are backlogs in all of the personal protective equipment and other equipment. So when we're talking about masks and gowns and gloves, um, we got what's called the Strategic National Stockpile Shipment. So the federal government has stockpiles of personal protective equipment and that it distributes out in times of emergencies. We just got a shipment, I believe, on either Sunday or Monday, and we shared it with the hospitals and with some other facilities who have the highest level of need, so long-term care facilities. It's a start. It's not enough. Um, we know that, and we know that I've spoken to the county executive, and he's speaking with the governor and pushing on the federal level to get more equipment. But there's also a lot of work being done around um, individuals making personal protective equipment and small companies doing that, and also shifting our manufacturing sector towards that. And there are folks in the county who are working actively on being able to use that method to just create more PPE. So stay tuned. We're working on that actively, and I'm hoping that we can see some real progress on that in the next few weeks.
The next one is, some data suggests patients should not take ibuprofen to reduce fever because it would actually embolden the virus and make you feel worse. Is this true?
That's a great question. This is an interesting time. We are seeing scientific information come out at a speed that is unlike any we've seen before, and we're sort of flying by the seat of our pants. There's similar questions in terms of treatments that are being tested and that might be effective. I think that the answer that I would give to somebody is this: if you can use something else to bring down your fever, do so. But if nothing else is bringing down your fever and ibuprofen is what works, then use that. It isn't really a solid piece of evidence, the whole issue around ibuprofen. And so where you can use caution, you do, but I wouldn't stand by that as an ironclad rule. Don't use.
Thank you, doctor. Now, this question is asked over and over again, and it is, can you get COVID-19 more than one time?
So it's hard to know that answer, and I'm going to talk about what happens with other coronaviruses. So typically when you get a different coronavirus, and coronaviruses as a family of viruses can cause colds. When you get one of those, you develop immunity. It usually lasts for less than a year, but you do develop immunity. We expect that, and we're seeing that people are developing immunity to it. The question we don't know, the question we can't answer right now is how long does that immunity last? And we really can't know that because we're just so early in the course of this disease. But the short answer is yes, you do develop immunity, but it's not clear for how long.
Thank you. Why can't we find out where a positive patient has been? We may have been in the same grocery store. Isn't that a risk?
It is a risk. We are always balancing a person's right to privacy for their own health information with the public's need to know public health information. That's why we do two things. One, we release the county in which there are positives. That gives you a general sense. Obviously, in a county this size, it's pretty large. But the second thing that we do at the health department is that anytime there's somebody with a positive case at this time, we talk to them about who they might have come into close contact with. And then we reach out to those people to see if they're having any symptoms and to make suggestions as to whether they need quarantine or not. It's also why we talk about social distancing. It's why we talk about the infection control. The better you do that with everybody, regardless of whether they have symptoms or not, the less likely you are to get the virus. Because in fact, you don't really know who has it. And we're not going to tell you this person has it, they live in this house. That wouldn't be fair to that person either, and none of us would want that happening to us.
Thank you, Doctor. Pam? With the senior centers closed, how is your department keeping seniors engaged and active?
That's a great question, Ellen. So this has been, talk about a silver lining. We have been trying to do some things online for a while. So yesterday, we just launched a virtual socialization experience for the members of our senior centers especially. And we're putting some activities on there, some entertainment, things that these are actually instructors that they were used to in their senior centers. We have the senior center directors that are going to film a little bit every day and just check in with them by video and let them know, I think everybody misses each other. And so I think it lets our senior center members know that their director and staff are all okay. And it gives us a chance just to give a shout out. So we just started that yesterday. And we're open to suggestions on that, what you'd like to see on it. We're working with our own PEG studio here. It's been fabulous helping us put together that show. So that you can find on Facebook. I think it's going to be on YouTube. It's on Channel 98 and all the other public stations, I think, on 32 for Verizon customers. But I think the big thing we've been doing is calling people, these phone calls I talked about. They've been, people are really encouraged by those phone calls, and the feedback has been really positive. They're so glad to hear from us and have a conversation. And it's good for our staff too, because we miss each other. We've been doing a lot of teleworking, and we really, it's been good for the staff as much as the clients. One thing we want to get up and running is we have a lot of caregiver support groups and a lot of caregiver activities, and we haven't been able to launch that yet, but it's next. So we're working on that. We want to get our caregivers reconnected because that is a family caregiver. That's a lot of pressure, and we don't want them out there too long without the support they were used to from our department. And I did want to mention one of the other things is through our meal program, it's Tuesdays 11 to 1. So that's another way we're reaching out to people. We're checking on their nutritional needs. And but every senior center on Tuesdays from 11 to 1 will be distributing these boxes of meals. And again, just sign up for those in advance so we know who to expect.
Pam, also, how can neighbors of a senior help during this time of social distancing and isolation?
So checking on your neighbors, we always hear that during any emergency, but this time we need to do it by phone. You could offer to get groceries, but just leave them outside. If you do have to go into the house to see your neighbor, Department of Health recommendations are that you have a mask and gloves and just go in and get out of the house as quickly as possible. But just a phone call, and Catherine mentioned earlier, there's Marco Polo, there are all kinds of apps out there if you don't have the iPhone, or Facebook call or FaceTime. So all these technologies are really coming into play. I've learned more about technology in the last week than I thought I would ever know. But neighbors should just be checking on them. And you know what's really important? If you have any worries about your neighbors, I want you to call me. I want you to call the Department of Aging and Disabilities. And we have protocols in place. We have social workers, RNs, certified options counselors, and we'll know what to do. And we'll know how to reach out to that neighbor if you have any worries. So take comfort that there's a whole department of professionals waiting to help you check on your neighbor and provide supports.
Thanks so much. Catherine, we're seeing a lot of Facebook posts from parents with teens who are struggling because their teens are mad that they're being forced to stay inside with family when their friends are still hanging out. How can you handle an angry teen who may not understand the seriousness of this epidemic?
Providing them with accurate information as to why you are doing that. The importance of social distancing is what is going to get them back to their regular lives, hanging out with their friends, doing their favorite thing in the world, going to school. That's really important that they get to do that. While we're in this current state of emergency, they need to stay home. They really, really need to stay home. They need to practice good hand washing, but they can also communicate with their friends via Facebook, via WhatsApp. There are a whole host of social media platforms that kids can still communicate with each other. The way we're communicating is just, it needs to be different right now.
For younger adults who are generally healthy, this is one of the questions we get a lot because they're going to be the group that is going to come, even if they get COVID, will recover fairly quickly. And you know, we're really trying to talk about not just how it affects you, but how it affects others around you. And that the social distancing steps that you take don't just protect you, they protect your loved ones. They protect your parents, they protect your grandparents, and other family and friends. So that's really important to talk about as well, that, you know, the idea that we're in it for each other as part of this effort.
We encourage children to stay home, but this question is, for some children, the worst place to be is at home. What resources are available for those children?
You know, one of the challenges we always have is not everybody's home life is what we would hope it would be. We do know that some of this social connectedness, if there is someone that you are worried about, call the family, check in with them. You can always call crisis response. We are still running. But if you suspect child abuse or elder abuse, you do need to report that to social services. But during this time, we are really working to minimize the stressors for families so things don't escalate in homes.
Catherine, is the county seeing a rise in more crisis situations since this COVID-19 emergency?
A good question. Actually, we're not, through crisis response, we are actually not receiving an increase in our call volume. However, the acuity of the calls are different than they were a few weeks ago. The time that it's taking either to talk to somebody on the phone who's worried about what's going on, or when we do send a team out of clinicians, that is taking longer. This is an additional thing that we have to address with individuals and families in the community.
I would have to echo that because I mentioned that how our staff and other departments are calling people. The phone calls are starting to take longer. Mm-hmm. So last week it was like, we're good. But this week the phone calls are getting a little more in depth and taking a little bit longer with our staff, which we're happy to do, but we have noticed that same trend.
Thank you. Dr. Nilesh, how are homeless people able to follow healthy hygiene and social distancing practices?
Yeah, that's a really important point, and it's one we've been working on with our Department of Social Services, and the homeless shelters, and also the outreach work that they do to people who are unsheltered. So we've been in conversation with the shelters to look at how they're within the shelters maintaining social distancing, moving some people out into hotels and motels to make sure that we're creating enough distance between people, reaching out to people who are unsheltered to give them information and give them options to get temporary housing, and providing as much education and engagement as possible to help them with this. It's still something that is deeply concerning to us. We know that people who have been homeless for a long period of time have adapted to that way of being because we as a society haven't provided affordable housing, and so it's hard to switch those adaptive techniques that they've had to create on the fly. And so it just means that we have to work harder to support them and try to work them into safer housing and be really vigilant if they do develop symptoms.
Thank you. The next question is, if someone in our own house gets sick with COVID-19, what are the main things we can do to prevent catching it?
It's the same things, except let's talk about how you do that in your house. So if ideally there's a room that person who is sick, who has symptoms, and actually that's whether or not they've been diagnosed with COVID-19 or not. If they have symptoms, they should be in one room, isolated. Whatever materials, books, computer, TV, phone, whatever, to keep them engaged. And really, that's the room that they live in now. If they have to go to the bathroom, that's the only real reason to come out. Food should be brought to that room, empty dishes taken away from that room. And others should, to the best of their ability, if that person has to come out, maintain 6 feet distance. It's really hard to do that. It's really hard to not be there for somebody who's sick, but that's how we're going to limit the spread of this disease. And I know that a lot of people out there have actually gone through this. It's challenging, but it's doable.
Doctor, in the workplace, do you have a message for employers of essential businesses on what steps or guidelines they should take to ensure worker protection?
Have guidelines on our website that employers can reference. One of the biggest things we ask is that if employees can telework, to do that. That creates an easy opportunity for social distancing. The other is to look at how people are seated and or how people are working, where their primary work is, and making sure that you have at least 6 feet of distance and as much distance as possible between people. If you're not able to maintain that distance for specific reasons related to how that work is being done, it's really a good idea to make sure that you're checking for symptoms as well. Obviously, promoting hand washing and making it available as much as you can. Hand sanitizer, disinfecting frequently touched surfaces are really critical steps as well in limiting the spread of disease. And then the most important part, everybody is used to working through colds. Everybody is used to working through some mild symptoms. Don't. This is the time when there are mild symptoms, or any symptoms actually, let me say that, to stay home if you're an employee, and as an employer, to reinforce that message that people should stay home and to make it your practice. That's what you can do, because if people are coming in trying to work through it, it's going to spread.
The question is, if my workplace doesn't practice social distancing, should I call somebody or report it to someone?
We'd actually ask that you call the health department, and all of the supports that the health department has, that interest around volunteering, that kind of thing. There's one number for that, 410-222-0600, and let us know, and we'll be happy to figure out what's going on. And we'd be happy to work with individual employers to help with that guidance and figuring out, what are the barriers, what are the things that we can do. I think it's really important that you share that information with us. So we encourage you to make that call.
Thank you. Pam, what precautions should home health staff and caregivers use when visiting patients?
Thanks, Ellen. That's a good question. The department does have several programs that help older adults and people with disabilities stay in their home for as long as possible, preventing nursing home placement. So we have a lot of healthcare people that are coming in and out of homes. We have people coming in doing chores, hygiene, bathing, things like that. So we obviously have gotten guidance from the Department of Health. We need them to wear personal protective equipment, the PPE that everybody hears about, to make their visits as short as possible. One of the big things we have them doing, based on guidance we've received, is to do a screening on themselves and on the client before they go out, because they want to ensure that nobody is symptomatic. But we still have necessary in-home care going on, because without it, we would have people that would perhaps be nursing home level of care without that home aide coming in. And we don't want that either. We don't want people having to move to a nursing home when we have a health care aide that can come in and support that individual.
Thank you, Pam. Such good work. Do you need volunteers that can help with anything or any donations that would help your department?
Thank you. Yeah, we are, tell you what, the county employees have been amazing. So we have been able to not only work from within our staff, and I tell you what, we have identified unique skill sets in some of our staff. This has really brought our staff even closer. So we're doing well with our own staff, but we also have brought in people I mentioned from the Office of Information Technology, even planning and zoning, police cadets, fire department. Excuse me, I am well. I've just been talking a lot. So this past week. So we've gotten a lot of support from within county government. So right now, I don't need volunteers for anything right now, but I ask that anybody interested in volunteering, please call the Office of Emergency Management, which is compiling a list of people from the community who want to volunteer, because we will need you. Right now, it's been so fluid. We've been trying to stage some very emergent needs within our own department, but we absolutely want to layer in the community as we get steady on our feet with all of our critical programming. The number, Dr. Nilesh just mentioned it, 410-222-0600. Even I tell you, our Office of Transportation is delivering meals. So volunteering, we've seen people just be so helpful and come together in this emergency.
Thank you. Catherine? People with chronic diseases are considered high risk for COVID-19. Addiction can be considered a chronic disease. So is someone who has a drug dependency more likely to get COVID-19?
No, they're not. That's a simple one. Yes, yes.
And then the next one is, I feel depressed but don't have any money for counseling. What can I do?
One of the first things we'd like you to do is actually call our warm line, 410-768-5522. We can get you connected if you don't have insurance to insurance. We can also get you connected to either pro bono counseling or sliding scale counseling. That's something that they can help you with. And that number is 24/7, so it doesn't have to be during regular business hours.
Thank you. Dr. Nilesh, this question just came up. Can I donate blood?
So blood, you may have seen in the news that there is a blood product shortage. That's a great thing to do, actually, and we encourage you to reach out to the Red Cross to find out where there's blood donation sites and events are happening.
Okay, that was a quick one, too. This one is about surfaces. How long does the virus stay on a surface? We seem to hear a different report every week.
So you seem to hear different reports because we are studying the virus and you're getting information in real time. And so as we learn more, we refine our advice. But generally what we're seeing is that it can live for up to 3 days on hard, non-porous surfaces, so things like metal or hard plastics, and generally for less than 24 hours on porous surfaces like clothing and cardboard. The best way to really handle that is to disinfect that which you can, so wiping down those hard surfaces, and if you're not able to, with something like cardboard, and this comes up a lot with packages being delivered, if you let it sit for a day, you should be good. And then, of course, always after you handle it, hand washing.
Could I add to that our meals, so to your point, our meals are coming in cardboard boxes, our frozen meals, so we've asked all of our clients to wipe those boxes down on the outside before they try to open the box and take their frozen meals out, and to just hand wash and sanitize as they're storing those meals in their freezer and refrigerator.
This one also has to do with food. Can the virus live inside food you carry out or have delivered?
Generally, no. The answer is that we're not really seeing that it's transmitted by food. I think the issue is more just the packaging the food comes in. So if you have a takeout container, just be aware that you should wash your hands after opening that. But the food itself should be fine.
Okay. Doctor, could this pandemic last into the summer? And is there any prediction based on other countries?
So it's a little hard to tell based on other countries. We're really watching closely what they're doing. China, South Korea in particular, because it started there earlier. They have a lot of the social distancing, measures that are really much more strict than we are at this moment, and they're continuing them. So we're constantly watching and looking. We do expect this to last for months at this point. I would say that we should definitely expect it to last fully through the spring, and we're looking to see what the numbers show in terms of how many people are being infected and what's happening with our hospitals and their capacity. But no, this is not a weeks-long process. It's a months-long process at this point.
People keep saying it's going to get worse before it gets better. What is the worst case scenario, and what is the best case scenario, and what role do we play in each?
So what we mean by that it's going to get worse before it gets better, is that we know that as this virus spreads, more and more people will get sick. And the real issue we have is that as people get sick, there's going to be a small number of people who need hospitalization and that intensive level of care. If we took none of these social distancing measures, it would spread really fast. A lot of people would get sick at once, and a lot of people would need that hospitalization and that intensive care all at once. And our hospitals wouldn't be able to handle that. They're not built to handle a mass pandemic. So that's why we're putting all these social distancing measures into place, these closures into place. It's to slow the spread down. By slowing the spread, we get three things happening. One, we give hospitals the time to ramp up their capacity. Two, we delay how long it is until a lot of people get sick at the same time. And we make it so that not as many people are getting sick at the same time. It's going to last longer, but there's fewer people sick at any one time, which means our hospitals are going to be better able to handle that volume. And three, the longer it takes, the more people who build up immunity, the slower it spreads. Just kind of like how we do with the flu, and we have the flu vaccine, and the more people who are vaccinated and immune, the harder it is to spread. The more people who've had it and are now immune, the harder it is to spread. So that's really what we're looking at. It's hard to give you numbers because this is, once again, we're living through it. We can't really predict exactly what's going to happen, but we do know that taking all of these measures will slow it down and make it more manageable.
Thank you. I know someone who makes homemade masks. Does the health department accept them, and do they protect against the spread of disease?
So right now we're not accepting homemade masks. I think that there's a place for homemade masks and other types of personal protective equipment, the PPE that we're talking about, that doesn't meet the strict regulatory criteria for what we would use in a healthcare setting. And the place for that is in low-risk community activities. What we really want to do is use it there, and that way we don't use the personal protective equipment in those low-risk situations. We save it for the healthcare setting.
Thank you, Doctor. We have a few more minutes for our Facebook Live, and I wanted to ask each of you the same question, and that is, every cloud has a silver lining, which means that you should never feel hopeless, because most difficult times do lead to better days and sometimes bring out the best in people. So we would like to know, what has been your one silver lining so far in this experience with COVID-19?
I would say that the irony of the COVID-19 and having to be socially to practice separation is it has actually brought us all closer together as employees. We are truly a work family. We've always known that, but it has really been more pronounced now than ever. I mentioned earlier we have identified skill sets in people that have volunteered. We have one employee who's managing all of our pet requests. We have older adults, and we love all of our pets. She's managing all the pet requests with animal care and control. So it has brought us really close together, and we miss our clients and our senior center members so much that it's also, so you asked me for one thing, I'm going to say two. It's kind of pushed us into some technology that we've been wanting to do for a long time so we can stay connected because we miss them so much. So silver lining is it's really brought us closer together, figuratively speaking.
I would say how resilient we are as a community, how the community at large, whether it's in our neighborhood or in the county or in the state, how everyone wants to pitch in and do something to help. That for me is just an incredible thing.
Yeah, and building on that, I think it's the creativity that's noted. Just watching people make masks, look at how 3D printing can create equipment, or really low tech. So creating community groups to help out those neighbors who need help, whether that's meals or running for groceries or trying to keep those with illnesses from going out so that they don't get exposed. And you see that really community level efforts that are low tech that are really nice to see.
Thank you. And thank you for joining us today. It's been very enlightening with the factual information, and it has the head and the heart here with COVID-19. We are still accepting questions that we can answer. You can email us at covid19info@aacounty.org, or you can call our health line at 410-222-7256. We'll see you again next week, same time, same place. Thanks for coming.